COVID-19 created an enormous disparity, particularly for communities of color.
For Blacks, Latinos, and American Indian Alaska Natives, the excess deaths were quantifiable in both sexes, clearly compared to whites or Asians. There was also excess impact in Native Hawaiian and Pacific Islanders.
We know during the pandemic that African Americans were 3 times as likely to die from COVID than their white counterparts. Over 200,000 children have lost their primary caregiver due to COVID, and 65% of the children who've lost their parents are Black and brown.
Access to resources such as housing, water, food, the opportunity to shelter, to access testing and vaccination present the most adverse circumstances for Native people. That explains the disparities that American and Alaska Native people experience with respect to COVID-19.
We actually shouldn't be surprised that communities of color that have been systematically disenfranchised over the years experience those disproportionate rates of infection and deaths.
The reason people of color were much more likely to get COVID was because of exposure. But if you were a bus driver, or you worked in a hotel, or you were a sanitation worker, you had to go out, keep our society going, and therefore you were much more likely to be exposed to the virus. So it wasn't about race, it was about occupation.
It was a Friday in April. The data came out showing that African Americans were disproportionately infected by COVID, hospitalized due to COVID, and dying from COVID. And then we opened up. No more stay-at-home orders. Mask requirements went away in the majority of the country. And for me as a Black person and as a physician and a public health professional, it was a slap in my face.
We've always known about health inequities, but what COVID-19 did was raise that visibility of those disparities so nobody can say they didn't know about it.
Welcome to Exposing Disparity, COVID-19's long-term impacts. I'm John King. Thank you for your time. We have an amazing, diverse group of experts with us today to look at one of the most glaring issues of the pandemic, the disparities in the number of cases, the severity of infection, and the long-term impacts of COVID-19, and why those differences fall along racial and ethnic lines. Let's jump right in to the conversation. Again, fabulous panel. I'll call you all COVID heroes. People on the front lines who helped us understand, who saved lives in the process. So let's go back to the beginning. Sandra, you are a frontline nurse, critical care nurse in Queens, New York. The first case is in Washington, then there are some cases in California. Everybody in the country is thinking, what is this? Is it limited to the West Coast? Is it coming to us? Take us back to when you first saw it, and then the moment when you realized this is exploding.
That's right, John. I work for Northwell Health, the largest private employer in New York State. And in March of 2020, I served as the director of nursing for the critical care division at one of our large tertiary care hospital, Long Island Jewish Medical Center, right in the heart of Queens. And I remember on March 7th, we admitted our first patient diagnosed with COVID-19 to our intensive care unit. And we were very, very careful to make sure we don't have cross-contamination. But by March 13th, I remember very well because it was Friday the 13th, we were talking about expanding our ICU capacity from the already 48 beds that we had to add an additional 12 beds because the volume of people that were coming in from the community requiring our care was just out of control. So we opened that additional intensive care unit on March 14th, 2020. And by Monday, March 16th, it was a different place. All the beds were filled with predominantly people of color, mainly Black men, just gasping for air, even on ventilators. That made me very, very scared. The staff, donned in personal protective equipment from head to toe, were just running around, and I could see the fears and the tears in their eyes.
The fear and the tears, those early days, haunting to think back. And Dr. Kowalik, you are the Chief Public Health Officer in the city of Milwaukee at that moment. You had already declared racism a public health emergency because it was a priority of yours, and you were among the first to raise the flag, saying, whoa, yes, this is bad for everybody, but it's especially a crisis in communities of color. What did you see? How did that play out?
Yeah, thanks, John. So since we made the declaration that racism is a public health crisis for the city and the county in 2019, our level of awareness was heightened. So we knew that gathering data about race and ethnicity was extremely important to be able to slow the spread of COVID-19.